Mononucleosis. It is a viral infection that we usually associate with teenagers. It is most common in teens, but Diane Atwood, who writes the blog Catching Health, is here to tell us that it can happen no matter what your age. Right, Diane?
That's right. Even babies and baby boomers can get mono. Now, it is caused by the Epstein-Barr virus, which is an extremely common virus in the herpes family. Most of us are exposed to it by the time we're 40, and we don't get sick. But if you do get sick with mono, the symptoms generally include extreme fatigue, sore throat, fever, swollen glands in the neck and armpits, swollen tonsils, headache, rash, or swollen spleen. Older people may not get all these symptoms. A friend of mine who's in her 60s was diagnosed with mono a few years ago. She just felt really tired and achy, as if she had the flu. Fortunately, her nurse practitioner decided to add a mono test to her blood work, and it was positive. It's easier to catch a cold from someone than to get mono, but here's how it's usually spread. The virus lives in the nose and throat and can be passed along in a cough or a sneeze, or by sharing a glass or eating utensils with someone who's infected. And of course, it can happen with a kiss. It takes 4 to 6 weeks for symptoms to develop after you've been infected, and the usual treatment for mono is rest, 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 which my friend forced herself to do, and although it took several weeks, she did recover. She has some advice. If you're not a teen anymore and you feel unusually tired, don't simply chalk it up to old age. Check it out, because you're never too old to get mono. And you can read about mono in adults and lots of other health topics on my blog, Catching Health. You'll also find a list of where you can pick apples in Maine. They're good for you, and it is the season. Just a little plug. Go to catchinghealth.com and you'll find all kinds of good things.
Yeah, all kinds of good stuff. Getting back to mono for just a moment.
Yeah.
It's a virus, so
Right.
there's no, you don't take antibiotics or
No.
anything like that for it. It's kind of like any virus, right? It's just kind of waiting it out and treating yourself well while you do that?
Yes, there might be treatment for some of the secondary problems that, if a person has a really bad sore throat, they might treat that to relieve some of the pain and swelling, things like that.
And you said in older people they might not see all of the symptoms. Is that because maybe they've built up some type of an immunity, or why is that? Is it known?
I don't know the answer to that, but I know it's the same thing with little children. They might not have the same symptoms. Like my friend did not have all the swollen things.
Right.
She
So
just felt like she had the flu.
maybe that's why we think of it more as a teen thing.
Well, as you get older, there are a lot of diseases or illnesses you can get where you don't have the same symptoms as you do when you're younger.
Good to know.
All right.
Thanks, Diane, very much. Get out there and pick some apples, too.
Yes,
We'll
sir.
be right back.